So when your baby's born, he or she will be wet and they're liable to get quite cold quite quickly. Skin-to-skin contact uses your body heat to help you maintain your baby's body heat. And newborn babies find it more difficult to regulate their body temperature, so they can get poorly quite quickly if they're cold. So they might drop blood sugars, lots of other different reasons. But it's really, really important that when they are born, they go straight onto your chest for skin-to-skin. And your heat that you've generated, which is a lot during labour, is helping them to stay warm. And it's amazing just how warm these babies get just by being on your skin. Now, your midwife's going to help you dry your baby and cover them over. And it's important that your skin's dried as well, because that first contact they have with you, they can get quite wet, can't they? So it's best to do skin-to-skin contact for at least an hour. And we call this time the golden hour. And there's so many benefits to this time. It will help with bonding, helps to keep your oxytocin levels nice and high, which in turn helps to deliver your placenta and reduce your bleeding. If you're breastfeeding, having your baby skin to skin will help you to establish your breastfeeding, as your baby is usually the most alert in that hour after birth. And that's really important because you need the hormones to produce the milk, to let the milk down. And just having baby there, close to your breast, even just stimulating your nipple is just sometimes enough to help get that milk supply running. And then of course they're close there as well, so that it's easier for them just to latch on. Now, your midwife or the support worker that's been helping you, they can help you to with your baby to latch on. And some babies, if left skin to skin, they'll just crawl to the breast themselves. And it's an amazing thing to see. Yeah. But most of the time, it just needs a little bit of assistance just from you and some support from your midwife. If your baby's small but healthy, you may be advised to continue this for as long as you possibly can. Smaller babies do lose heat a lot more quickly, so they definitely do benefit from being warm and kept at that right temperature. And again, small babies don't have the same fat stores, so because of that, they find it harder to regulate the blood sugars as well. So they need fed more frequently, they need fed more quickly. And if they're cold, they're using up that energy that they don't really have. So if we keep them warm, that also, it eliminates that issue as well. Now, if you don't feel up to doing skin to skin, it's fine because, for some women, labour can be really quite exhausting. So you can ask your partner to do it instead. And a lot of the time, partners really do enjoy that. They feel almost detached during labour because they're supporting you so much. So they do really enjoy just having that closeness. So apart from helping to keep baby warm, there's many, many other reasons why skin to skin is good for both you and your baby. It helps your baby's skin develop their own friendly bacteria. So they're completely sterile when they're born babies. They don't have any bacteria at all, except what is in your vagina and obviously on your skin. So they need to colonize this, and they need to colonize it with friendly bacteria. And this is known as their microbiome. And we all have our own unique system of skin flora, which is these friendly bacteria. And as your baby comes into the world, they need to develop their own. And that process starts by doing skin to skin. And it's that bacteria that are known to you and your partner that your baby's now covered in. And babies feel safe during skin to skin because they're close to that parent. They're calm and they're settled. They already know your heartbeat, your breathing sounds, the sound of your voice, the way that you talk. And it's from that time that they were in their uterus. And it's a powerful bonding experience for you and your baby, naturally raising these amazing oxytocin levels to create this. It can also help to regulate your baby's breathing. Midwives and doctors should always offer skin-to-skin contact as they know the benefits. However, you can also stipulate in your plan that you want immediate skin-to-skin and to not be separated from your baby until you're ready or they've had their first breastfeed. And that's really, really important that you don't feel that you've not got that say. And you can have it in your birth plan, you can ask your partner to say it, but it's still really, really important that you get that choice because it is so, so important for baby. Sometimes you'll be asked, can we just have baby so that we can weigh baby, just so that we can put a nappy on? And you don't need to do that. The only time really there's any necessary indication to remove baby from skin to skin is if they're really concerned about baby and they really need to look baby over. All these checks, the vitamin K, nappies, all of that can wait for at least an hour. Now, vitamin K, so giving vitamin K and labeling, so these are the labels that go around your baby's legs to say this is, baby born of you, so that we know exactly who they are. They are routine and just top to toe checks, and they are necessary, and they will want to do them as soon as possible after that hour.
But they can be done on you, so on your skin, can't they?
Yeah, absolutely. Certainly the vitamin K can, and nappies
the labels
if needing.
Yeah.
Just the weight. And unfortunately, that weight is one of those things that does need to be registered. And again, just going back to if there's concerns as well about your baby, your midwife or your doctor, they may want to just check baby over closely and move them to that assessment or treatment area. But again, sometimes that can be just done while they're on your chest. And you may wonder what will happen about the golden hour if you have an emergency caesarean section or even an elective caesarean section. Not so much with an assisted birth because they're already there. But once the decision for caesarean has been made, just tell your midwife what your wishes are for skin to skin, and they'll be with you just before you go into the operating theatre. So you can say to them that you want skin to skin immediately. And all that happens is in the operating theatre, they just put all the leads and things in different places. Now, as with any operation, everything's sterile. So it is just about bearing that in mind, that once your baby is born and they're on skin to skin, that you're conscious that you don't want to touch, or your partner doesn't want to touch those areas. But the anaesthetic team, they'll be able to help adjust any equipment that does need adjusted so that you can have skin to skin more easily. And then once your baby is handed to the midwife by the surgeon, they can be placed directly onto your chest. So vitamin K, now this is something that your midwife will discuss with you during your pregnancy, your antenatal appointments. And you will be asked to give your consent for vitamin K once your baby's born. Now, vitamin K is a fat-soluble vitamin, and we know that it helps with blood clotting. And this helps to stop any small bleeds when they occur. And we know that babies that are born with naturally low levels of vitamin K, but we don't know is why their levels are so much lower, for example, than an adult. Now, having low levels of vitamin K doesn't cause a potential problem for a baby unless they experience a reason to bleed. So if we have unexpected or internal bleeding that occurs, then potentially, if they have that bleeding condition, the deficiency condition, their blood just may not clot, or it may not clot as quickly. Now, approximately 1 in 10,000 babies will be born that have this problem. But one injection or one dose, even oral, of vitamin K can help reduce that risk down to around about 1 in 100,000. So it's not something that your baby has to have. You'll always consent to it. Most parents don't like the thought of their newborn baby having an injection. And if you decide to opt for this, studies have shown that breastfeeding and skin-to-skin contact can help to soothe and calm your baby. For a lot of babies, actually, when they're on the breast and feeding, they rarely actually notice. They rarely notice that injection. And then there's obviously drops that can be given orally. And the drops containing the vitamin K, they're given directly into your baby's mouth. So you'll get just a little pipette full and it's squeezed into your baby's mouth. But as with any vitamin that you take, we just don't know what that absorption rate is. So we know what's given into the mouth, but we don't know how much is actually absorbed by baby. So it's recommended that we give 3 doses of that oral vitamin K. So the first one's soon after birth, the second one when your baby's around 7 days old, and the third when your baby's about 4 to 6 weeks old. If you're bottle feeding though, that third dose, because of the addition of vitamin K into formula milk, you don't need that final dose. And some babies are more at risk of bleeding, and you may want to take these factors into consideration when deciding whether or not you do want to have your baby to have vitamin K. So if you're taking certain medications, for example, epilepsy, or you're on blood thinners, you can check with your doctor if you are on medications and whether they may affect you. And if your baby is born before 34 weeks, research shows that premature babies' clotting systems are sometimes not quite as well developed. And if you have an assisted birth, such as a forceps or a ventouse, as this can also cause trauma, such as bruising to your baby's head. If your baby has surgery or needs treatment for a tongue tie, as there's potential for bleeding during these procedures, you can also choose to decline vitamin K in the form of injection or oral drops. And when you decide what is right for you, write your wishes in your birth plan or let the midwife who is caring for you in labour know.
So delayed cord clamping is another thing you might want to consider after the birth. For many decades, in a variety of birth settings, we've clamped the cord immediately. So the baby is born and the cord is clamped straight away. Now, what we've realised now is that by clamping the cord straight away, is that we're cutting off baby's blood supply. So a lot of the blood when your baby is born, and that includes caesarean section as well, is in this cord and in this placenta. It was thought that even in the 1800s, Charles Darwin's grandfather was a doctor, and he said it's very injurious to the child to clamp and cut the cord really soon because it should be left until pulsation ceases. Otherwise, the child is thought to be much weaker. So we knew back then, but modern interventions have made it so we've clamped and cut straight away. Extensive research has now gone on to say that the practice of immediate cord clamping is quite detrimental for your baby. So unless there's a need for intensive resuscitation, it is recommended by the Royal College of Obstetricians and Gynecologists, the Royal College of Midwives, as well as the World Health Organization, that we leave the cord intact, at least for a few minutes. I've said that there's a lot of blood still in the placenta and the cord, but what good does that blood do? Well, that blood, it contains iron stores. So when your baby gets more blood into its body, the iron stores will be built up. And research has proved that babies who are 4 or 5 months old have much higher iron stores because they've had this delayed cord clamping. And it also transfers nutrients to your baby as well as stem cells and as well as white blood cells too, which the white blood cells fight infection. So if for any reason your baby, like we say, your baby is quite a sterile person when it comes out, if there's any infections around, the white blood cells help with that as well. So how long are we going to leave this cord for? The World Health Organization say it should be at least 3 minutes, but you can leave it for longer if you want to. I mean, in my practice, I've seen that cords can pulsate for 20 minutes after the baby is born. So there's no reason to cut it if you don't want to. So leave it until it stops pulsating if you can. So you'll be able to feel on baby's cord, and there's a pulse in it, isn't there?
And it goes white as well, doesn't it, when it stops?
And this pulse will just continue pulsing under your finger and your thumb if you do feel it, or if your midwife feels it, if you don't want to do that. And then, like Leslie says, it will start to drain of blood and you'll see it go. You'll see the blood vessels, and they are actually blue when you see them, and it'll just drain away and it'll become quite white. So that will be the moment when it's better to clamp and cut the cord. But you can actually leave it until the placenta is delivered if you're having a physiological third stage. Ask your doctor, if they're doing a caesarean section, to delay the clamping for as long as possible. At least for a minute, but longer if possible. But it depends on your circumstances. Do the delayed cord clamping if you can, and it'll be helpful to your baby, not in the short term, but also in the long term, building up those iron stores.